This is a short tutorial demonstrating how to interpret an abdominal radiograph using a simple system. Specific pathologies will be covered in separate videos. We are going to use an A, B squared, D, O approach. A stands for adequacy, B squared stands for bowel and bone, D stands for definitive landmarks, and O represents other. In an exam setting, it is important to have a structured approach to interpretation. This demonstrates an awareness of the amount of information that can be gained from an abdominal film. However, it is worth mentioning that this is an investigation that is over-requested and exposes the patient to considerably more radiation than a chest X-ray. An abdominal X-ray may be useful in the investigation of an acute abdomen when considering certain diagnoses such as bowel obstruction, volvulus, and calculi. Before you consider any radiograph, it is important to ensure that it is of the correct patient and taken at the time you anticipated. You should also ensure that it is orientated correctly with the left side on the right side of the screen as you view it. Abdominal X-rays are generally supine, but may also be lateral, erect, and decubitus. Let us now consider the film. We are going to use an A, B squared, D, O approach. A stands for adequacy. Ideally, a film should encompass the area extending from the diaphragm to the symphysis pubis. There should be sufficient penetration to outline the vertebral bodies. B squared consists of bowel and bone. Let us consider bowel first. In this film, a normal bowel gas pattern is demonstrated. Whilst the ascending colon is not in view, the hepatic flexure is illustrated continuing into the transverse colon and splenic flexure. As you can see, the splenic flexure continues into the descending colon, with gas extending onwards to the rectum. The anatomy is not always as clear as this, or may be grossly abnormal in pathology such as bowel obstruction or volvulus. Now let us consider bone. Outlined here you can see the pelvis and symphysis pubis as well as the sacroiliac joints. Here we have numbered the vertebra, the relevance of which will later become apparent. Superiorly we can see the ribs projecting from the thoracic vertebrae. D stands for definitive landmarks. The kidneys will lie bilaterally on the radiograph between the level of T12 and L3. The right kidney is lower because of the liver. The spleen lies above the left kidney. The bladder would be expected to be found within the area of the pelvis highlighted. O stands for other. Within the confines of an abdominal X-ray, you may find some other structures. These may include medical devices such as ureteric stents, urinary catheters, and PEG feeding tubes, as well as naturally occurring objects such as renal or ureteric calculi and fecaliths. If presented with a film in which the diagnosis is clear, do not be afraid to lead with the most striking abnormality. However, it is still worth reviewing the radiograph with a system such as A, B squared, D, O to ensure that subtle aspects of the film are appreciated. An example would be this radiograph, which shows fecal loading highlighted here. Other aspects include the bowel loops that are now shown, and extraneous objects such as the bra clasps. This concludes the A, B squared, D, O approach, which we hope will be of benefit not only for examinations, but also for your working life.